Hello, this is Dr. David Greene, CEO of the Nevada Pain Network, where we bring you anything and everything educational for pain management. Today the topic is, what are the indications for undergoing a spinal discectomy surgery for sciatica? Well, sciatica affects 1 to 2% of the population at any given point in time, and most people have no clue what they did to spark up the pain. It's typically due to a slow disc degeneration that eventually results in a tear of the outer disc, and the inner jelly part squeezes out and pinches on a nerve root, which is what you can see here. Most people weren't in a car accident or a jet skiing accident or something like that. Oftentimes it's the slow degeneration, and then maybe somebody just sneezed or they bent over the wrong way or they just got out of bed. The symptoms can vary from person to person. It may be significant leg pain in the affected side. Maybe it's a sensation of burning or pins and needles. It could be just frank numbness. Also, a person can have significant weakness and rarely incontinence. Initial treatments, short period of bed rest, 2 days or less, over-the-counter pain medications like Tylenol or anti-inflammatories, physical therapy, chiropractic treatment, spinal decompression therapy have all been shown to be very beneficial. Then there's the prescription medications. This may include a Medrol dose pack, which is a 5-day burst of prednisone that tapers off, narcotic medication, muscle relaxers, or neuropathic medications such as Neurontin or Lyrica. Interventional treatments may include trigger point injections to help with spasms and aching, or what you see here, which is an epidural injection where a pain doctor will inject cortisone around the area of pinching and inflammation, which bathes this area with soothing steroid medication. It's not going to fix this problem with the herniated disc, but it can provide pain relief while the body disintegrates that piece of disc. The indications for sciatica surgery are categorized into 3 indications. There's absolute, where the person has to have surgery; relative, which means there's an indication for it; and then there's quality of life, which is where it's an elective decision by the patient. So worst case scenario first is the absolute indication. Now what you see here in this picture is the spinal cord coming down. Okay, around L1 or L2 it turns into what's called the cauda equina. Okay, so it still looks like the spinal cord, but it's not the spinal cord anymore. It just has a bunch of nerve roots and filaments inside it. But if there's a large disc herniation, which you can see here, pushing back on the cauda equina area, a patient can end up with incontinence, severe pain, inability to walk, weakness, and that needs to be treated emergently with surgery within 24 hours. Otherwise, it could cause irreversible incontinence and other issues. So that is the absolute indication for surgery. Moving into the relative indications, this can involve motor weakness or a progressive neurologic deficit. So what you see here is a foot drop where the person has difficulty, lifting up the foot. And that's often from the 5th lumbar nerve root getting pinched and having difficulty with, lifting it up. So that can be watched for a while. The problem is we don't know how long it can be watched until it gets permanently bad, even with a perfectly performed surgery. So a lot of people will say we can watch it up to 3 months. Some will say 6 weeks, some say longer. We don't know exactly. It varies from person to person. So after a certain point, there's a relative indication to do surgery. And if it's getting worse, like if it's a partial foot drop, but then it gets a lot worse, that's a higher indication for surgery. And the last one is the elective quality of life decisions. If a person has significant conservative treatments for 6 to 8 weeks and it is just not getting better and it's intolerable for a patient with all the medications, PT, spinal decompression, the injections are not helping, then the indication for surgery is there. It doesn't have to happen. A person can wait, but they basically have tried the things to get pain relief. So what are the outcomes of sciatica surgery? Well, less than 10% of people will actually need surgery who have sciatica. And some studies show less than 5% will actually need surgery. Over 90% who undergo a discectomy will have good to excellent results. There are some minor but real potential complications, such as infection, bleeding, nerve injury, things like that. In 2006, there was a landmark Journal of American Medical Association study looking at people who had a discectomy surgery versus those who waited. And this was in the elective category. The outcomes were identical at 1 year. What they showed is that those who had surgery earlier were able to get mobility back faster, decrease the pain faster, get back to work faster. But at the 1 year point, no difference. The Network has the top pain management clinics in the greater Las Vegas area, including Summerlin and Henderson as well. It's a one-stop shop, really. The clinics have board-certified pain management doctors doing both medications and interventional treatments. Also have spinal decompression therapy, chiropractic, physical therapy, acupuncture, and more. They accept over 50 insurances. There are several locations. The doctors have won the Patient's Choice Award for 5 years in a row, so very high level of care and compassionate doctors. Call 702-323-0553 for scheduling, and visit us on the web at nevadapainnetwork.com. I'm Dr. David Greene with the Nevada Pain Network. Your pain stops here.